So conclusion, and we'll open up to questions. Clearly, it's important that students get experiential training so you can develop real clinical skills, interacting with other healthcare practitioners and with patients. And the students can be positioned both to be involved in errors, but also catch errors as well. So that's important to see both sides of the things. I think it's important that facilities and schools work together in this, so we know what are the expectations on both sides, and to address factors that may contribute to errors from both arenas, schools and facilities. And really, it's maximize the capability of students to catch errors just as much as them being involved in errors. So Kelly, on that note, I'll turn it back to you for instructions for Q&A.
Thank you, Matt. This was a great presentation with valuable information everyone can utilize in their organization. That concludes our slide presentation portion of our program. Now we would like to begin our question and answer period.
Thanks, Kelly. I see that we had someone put some comments, which is great. So we asked the question about, how are you handling situations with students in regard to having access to electronic health records, and states here that when she was a student, that they were given access to the EHR, and they were taught how to utilize the aspects of the record that they should use, such as the EMR again, and how to document vital signs and other things like that. Also, she says here, when it came to medication administration, there were always 2 students for each clinical day that were assigned to give meds, and it wasn't to be done unless the instructor was present. And then they were quizzed about the medications being given, which is good. And I would hope that the quizzing is not just of the medications and what they're used for, but also, giving an IV drug through a smart pump is a lot different than giving an oral tablet. So hopefully this questioning also includes the processes associated with being a nurse as well. So right now, no other questions. Anyone have questions? Let us know on the QA line. Has a question. Is there a best practice student orientation template that can be shared? I kind of wish there was one, but right now I am not aware of one. But maybe it's something that we need to consider helping develop. I agree that the type of student that comes in, the orientation for a pharmacy student is different than a nursing student, but there's probably some overarching areas that we should consider developing for you. So that's something we should take into consideration. But thank you for that suggestion. Any other suggestions, any questions out there in regards to healthcare students, your experiences, etc.? Has here, when having students at your facility, how does the policies or procedures work? So do they follow our policy procedures, or does the school have their own that they have to follow? That's a fantastic question, and I think that's a question I don't have an answer to, but that's the classic example of why facilities and schools have to sit down together from the big 30,000-foot view level about students. What are the expectations both ways? So if I'm a student at Wilkes College or Gwynedd Mercy or Temple School of Pharmacy and I'm going in, so I assume I'd follow the facilities policy procedures. It's your medication use process, so I should be following your policies and procedures, etc. In fact, I honestly don't know how schools would even have appropriate policy procedures because they're not involved in taking care of patients. They're there to teach students. That's 2 different things. I'm going to default to the facility, but that's something, again, I think overarching both sides have to meet with. As here, the students in their facility must attend a half-day education session. Students give medications through the MAR system, medication administration system. Do facilities share any medication safety events with the schools if new nurses are involved in the error? I know there have been other times where people have had medication safety days where it's almost like, I guess during lunch they have poster presentations and ways to teach people about errors in general and why they occur, even whether they're involved with new nurses or not. But I think that's something to consider as well. I know in our example in Pennsylvania, people are submitting all type of events that mention students. Now, we don't know if they ever mean new nurses because when people type out error reports, I doubt they will put in there oh, this involved a new nurse. So it's tough to glean that from reports because people aren't coming out and saying the word new. They may say, at times you'll see orientee as an example. Not much, though. If you think about, there were 711 reports we talked about in this event. Overall, there's over 530,000 medication errors in Pennsylvania. There were only 800 hits that had the word student in it. So, well, not that many there. Not saying it doesn't happen. Clearly, we're not seeing it at our end. And my question to you is, so how could you maybe identify both students and new nurses, but also use that information globally to address your system to prevent errors in the future? My concern is, and I've seen this in reports sent to Pennsylvania, is hospitals are very quick to punish students. No offense, that's not your role. Your role is to teach them to prevent errors and to give meds safely. And punishing a nurse does no good. Or you can tell them to punish them and read the policy again. That doesn't do anything good either. So that's important consideration to consider as well as how you handle an error. Well, Kelly, at this time, I don't think I see any more questions that came in here, so I'll turn it back over to you.
Matt, did you see the question? There's one that does Pacers use the ISMP categorization?
Does Pacers use the ISMP categorization? I'm not sure what you mean by categorization, if you mean by harm score or event types, but I work at ISMP, but we're using the Pacers system and the databases that were provided in that. So that means, the event types are Pacers. The harm index, the A through I, is the NCC MARP harm index. Otherwise, we don't have any other type of categorization. The harm scores, technically that's the NCC MARP harm index, A through I, and Pacers does use that. In fact, the slide I had with a bar graph from A to I is based on that. Now, the only caveat is that is based on what facilities picked, which may, at times, may not be the most accurate thing in the world, but that is the method used. And on that slide, you saw there were only 4 serious events out of all those reports that were reported as serious events. Mostly season Ds came in there. Oh, and she also put something in here. Facilities in our area varying whether students can give meds. Some facilities do not allow students to give meds. The facility I teach in allows meds to be given under the direction of an instructor. Well, that kind of concerns me. If you're a facility and you don't allow students to give meds, then why are you taking students for? Well, I'm not sure how they're supposed to learn, by watching. Yeah, I'm a little concerned about that, but that's a different topic for a different day. Okay, Kel, I think that's all of them then, right?
It looks like it. Thanks a lot, Matt. That's a lot of great information. I want to thank everyone for joining us today. This concludes our webinar. Thank you.